Today I will be talking about shoulder and wrist MRI setups. Let's start with basics. We have to set up the shoulder MRI for the next patient. We start with demetallizing. I take all the accidental and not accidental ferrous loose metal things or electronic devices of my body. That includes watch, phone, keys, wallet with credit cards, loose change if that's happened, some pins in the pockets, anything that is not allowed in MRI in zone 4 scan room. After demetallizing myself, I will walk into zone 4. It's always under lock and key, so I will use my key to open the door to the scan room, and I will disinfect everything, meaning all the surfaces that are touched pretty much often by me or by patients. That includes doorknobs, also MRI table, as well as inside the bore, coils. I will wipe the coil and plug in the coil, and while wiping I will be holding moving it with 2 hands and never touch the or use the wire for that, for placing and moving the coil. So like I said, with 2 hands, never use a spray. We use special wipes for the coils. They're very expensive, and we will keep them safe. When also we need to change the linens, which is the sheet on the table and the pillowcase as well. Then I check if I forgot anything. Everything looks great, and I will walk out of the room and lock it behind myself. Well, there will be preparations when I deal with the patient, and then I will unlock the room, let patient in. After all the preparations like demobilization and the checks will be done, and I will be doing MRI. I will be planning in 3 planes: coronal, sagittal, and axial. So let's first talk about the coil we use in shoulder MRI. We have several choices. We have several dedicated shoulder coils, and we will choose one of those. However, sometimes we're in a hurry, this is an emergency, or sometimes the patient is way too large, so we're not able to use the dedicated shoulder coil. So for that, we'll just use a regular extremity coil. But for that, since it's not dedicated just for the shoulder, we have to adjust it, and the stripes will help us to hold it in place so it doesn't slide off the patient. Patient is positioned supine head first. The landmark will be shoulder joint, glenoid fossa. We have to, at any cost, avoid the prone position because we'll get the weird artifact as if we have a tear in the rotation cuff. So we make sure that the position of the patient is supine or neutral. but never prone. I will plan sagittal slices on axial plane. First, I will run the localizer, and it will give me a nice approximate picture, low resolution of the position of the patient and the body parts. So I make sure everything looks great, and I can proceed. Slice angulation will be perpendicular of the supraspinatus tendon. Slice coverage includes deltoid muscle to 2 slices medial to glenoid. Also, it's very important, I will add the saturation band to avoid the artifact, the movement artifact when the patient is breathing. The name of the artifact will be ghosting artifact. I plan axial slices on coronal plane. Slice angulation is perpendicular to the joint space, glenohumeral joint. Slice coverage covers superior to acromioclavicle joint, acromioclavicular joint, and into the shaft of the humerus, into axilla. Again, I will put the saturation band on the chest, preventing the ghosting artifact from breathing. I make sure I ask the patient to breathe normally, without deep breaths, just normally relax and not to move their head. I plan the coronal sequence on axial plane. Slice angulation now would be parallel to supraspinatus tendon. Slice coverage must cover all the shoulder joint from the arterial portion of coracoid process to 2 slices posterior to the humeral head. Again, I will add saturation band to avoid the ghosting artifact from breathing motion. Now let's go to the wrist. We are going to be scanning wrist, but it doesn't matter the procedure of preparation of the next patient. It's exactly the same, minus the coils, the specific coils. So I will be dermatolizing myself again, checking my pockets for all the unacceptable items unacceptable in MRI room zone 4, which are ferrous loose metal objects or electronic objects. So phone is out, watches, keys, all kinds of loose change. Maybe it will be Canadian coins, so God forbid, that's a bad thing. No makeup, no pants, no pins, nothing. So empty pockets, no badge, because it has the metal clip, nothing. Again, I unlock the MRI room and I walk in with the cleaning wipes. I wipe the bore, inside the bore, I wipe the bed, the scanning bed. I wipe the necessary coils very carefully, plug it in. I wipe the doorknobs and I change pillowcase and the sheet. Now it's time to do the MRI of the wrist. For MRI of the wrist, we use the special wrist coil. This is awesome coil for that particular body part. It is dedicated HD wrist coil. Like I said, I already wiped it, prepared it, and plugged it in the scanning room. The dedicated wrist coil is always preferred, but we can use also knee coil or some flex coil, but HD coil, wrist coil is preferred. We position patient for this exam Superman, head first. In case the patient cannot do that, they raise their hand above their head, it can be supine. Landmark is carpals. I plan axial sequence on coronal plane. Slice angulation parallel to the joint space. Slice coverage will cover from metacarpals to the radius and ulna through entire wrist. I plan coronal sequence on axial plane. Slice angulation parallel to radius and ulna. We make sure we also cover carpals. Slice coverage from dorsal to palmar aspect. I plan sagittal sequence on axial plane. Slice angulation will be perpendicular to the distal radius and ulna. Slice coverage will be from skin to skin, meaning from side to side.